We're here with Lindsay Farrell, who is the CEO of Open Door.
Family Medical Center.
Okay, bit long name.
Very long name, and there
But
are like
it's been
5 open doors.
It's been Open Door, yeah, but I think yours was the original Open Door.
I think so.
It's been around forever in Ossining, New York. And Lindsay, you've been with Open Door.
33 years.
Wow.
Yep. I was
So
12.
It's a lifetime commitment. Yeah.
No,
Well,
I know that, Dan, because I went there. I've been paid for 33 years. I was not paid for 2 years prior. So I have a daughter who's 35 and a son who's 33. And that's how I know how long I've been at the health center.
There you go. Actually, you volunteered, didn't you?
I volunteered for 2 years. So it was really a great time in my life because I had a brand new baby who now works for the Department of Health and Human Services in Washington, working on Medicaid policy.
Wow.
But I left New York City, had this brand new baby. I lived in this cold, drafty house, and I had to get out. And I was a driver. I picked up patients at a home for the elderly, and I drove them to the health center. Didn't have to get a babysitter. Brought my daughter into the waiting room. We sat there, and I fell in love with the place.
How about that? That is an incredible experience. And it sounds not that different from my own. We went through those machinations I mentioned with the Community Action Agency after the Vista deployment, and then work at the Methodist Church Settlement House. And then they offered me the job, and I thought about it. At first, I wasn't sure that's what I wanted to do. And anyhow, my major undergraduate in college was modern languages. Español, gracias a Dios, so I could speak the language. But I knew nothing about healthcare or management. As I told the board, I can't even manage myself. And they said, just hush up and run it. You'll do fine. So they saw something in me that I didn't see in me. And I suspect that in your case it was very similar.
Very, very
You knew you
similar.
had, I think you had to have known that you had the skill set needed to manage an increasingly complex healthcare system.
Truthfully, I didn't. I was the fundraiser. And so my job, look, I was a French major. And so if you can write a paper in another language, you do have some critical thinking skills. And I was a good French major. So I was good in convincing people to support the Open Door. My job was the first fundraiser. The board was sick and tired of raising money through bake sales and what have you. So they hired me, and I did the bake sales, and I did the fundraising auctions, and I graduated.
You made it more sophisticated.
I made it more sophisticated. I learned how to write grants, so self-taught. And I think once you can write grants, you can do a lot. But my mentor was the founder of the Open Door, Marge Griesmer, may she rest in peace, and she was very good to me.
Marge was an early icon.
She was an early icon, and she loved the Open Door. She founded it, and she loved it. And I think what she saw in me was I loved the Open Door as much as she loved the Open Door. And when it was time for her to retire, she did everything to get me that job. And I got it by 2 votes.
It was that close.
It was that close because I was the internal candidate.
Interesting. And when you landed there and you started, Marge was fabulous, I know. We all have our strengths and our weaknesses. So what did you note were the challenges that you faced as the new director of Ossining, of Open Door?
Ooh, I didn't write about this. I knew that I had to align the physicians with the objectives of the organization. And what I did was a physician compensation program. Oh my goodness.
Yeah.
Yes. I studied a lot. I bought a book from MGMA about physician compensation systems, and I formulated one that worked in our environment. And you know, Dan, I had 7 doctors quit.
Worked like a charm, huh?
It really wasn't a bad thing because it allowed me to sort of start anew. And it was the most important thing that I did. And I think that compensation system, which is more than 20 years old, has really allowed us to flourish and to thrive. And we're a very successful organization because we all row in the same direction at Open Door. And very often, physicians, they don't like non-clinical people. And I certainly was not a clinical person.
Yeah.
But we were all sort of rowing in the same direction. And the direction that we were rowing in was creating capacity in the community so that our patients could be seen and could get in and could be well cared for.
I suspect that those 7 physicians who left really were never right for Open Door.
Guess what? Some of them came back.
Did they? Realize the error of their ways.
Yes,
huh?
and there's nothing better when you've had physicians leave to have them go out and try it out there and then come back and they realize, what a wonderful organization we are and what a great place it is to work. And, look, the compensation is good. You get what you pay for. We just put a little bit of it at risk.
Well, people come and some people go, but the institution, the organization, what is the community's health center stays.
You're so spot on. And what I always say is no margin, no mission. And you have to have a little bit of a margin because there are always more people that need your help. In this day and age, there are many more patients than there is capacity. And so to the extent that, we can get people in and care for them appropriately, that's what we do.
Sure. But in order to maintain that margin, you're skating on a sharp edge because if you cut too harshly, you end up not serving the community as well as it needs to be served.
Yes.
So how did you focus on being appropriately businesslike in order to maintain the bottom line on a plus and yet be heartful enough, caring and compassionate enough to ensure that the services are available to those who need it most?
So I always put the patients first. And I think that's why I love health centers so much because we are governed and controlled by the patients themselves. So I think being very patient-centric, we have a large staff. There are 500 people that work at Open Door. And by leading by example and always putting the patients first, I think people recognize that sometimes there are decisions that need to be made that are difficult, but we always put the patients first.
I suspect, though, that even with the clinicians who left and returned, that clinician recruitment and retention, and not just clinician, but really qualified staff recruitment and retention, has always been a major priority for you as well.
Definitely.
And how have you done that in a way that has contributed to the success of Open Door?
I'm so glad you asked that question. Back in the day when we were really focused on margins, we had 1.5 people in our HR department, and we were very proud of that. When you only have 1.5 people in your HR department, you can't be very staff focused. And it's really important that we are staff focused because happy staff, happy patients.
There you go.
So we've made big investments in our HR department. We're very focused on staff engagement, staff communication. We even have fun things like we give massages. We have a day of massages.
You're kidding.
We have a day of Ben and Jerry's. So we try and make the work environment great. And we understand how hard our staff work. We understand that. And we also know, Dan, our staff doesn't necessarily do it for the money. Our salaries are indeed competitive, but what holds people to our organization is this incredible sense of mission and purpose. And I think when your personal values are aligned with your professional orientation, you're a well-aligned and very happy person. And so that's what we strive for at Open Door, and I think it's really worked.
Yeah. And your board?
Wonderful
supportive?
board. Yes, very supportive. We actually have 2 boards because we have a foundation. And so we have a fundraising board that raises money, and then we have a health center
This
board.
this fundraising board is the outcome of the work you did
Exactly.
setting up the fundraising.
And you have a lot to do with it. Can I tell you why? We set it up before FTCA. So we had received some wonderfully generous contributions that were just sort of sitting in our bank accounts. And we were really worried that there could be malpractice claims that could jeopardize those resources that were given by, wonderfully concerned and generous members of the community. So we decided that we needed to create a separate organization to put the proceeds of our fundraising revenue. So we created the foundation and put all of the proceeds of our fundraising efforts in that. Now, again, we don't have the risk anymore, thanks to you and FTCA.
All of us.
Thank you. But it also was a place where we could put board members that didn't have to do as much work as the board members from the medical center. So the medical center is the parent of the foundation. Sometimes they don't like to feel like stepchildren, but they are.
Well, that's great. That's great. And I remember that there was I'm blanking on the name, but a Republican member of Congress who played an important role in the FTCA.
Hamfish?
Yeah.
Hamfish.
Hamilton
Good guy.
Fish.
Yeah, good
Yeah,
guy. They don't
great
have
guy.
Republicans like that anymore.
Not like that anymore. Certainly not on Capitol Hill, on either side. Such a shame.
Such a shame.
People like he, Lowell Weicker from Connecticut, Bob Stafford from Vermont, these were folks who, they may not have been liberal in the sense that, Democrats and progressives are liberal, but they did care about their communities. And I remember sitting with Hamfish. He was no dummy. He understood. He said, no, you can't function like private practice. You can't say no to the patients who need you because it would be too much of a liability. And I don't want that to be the way you operate. So therefore, I'm going to do this for you. And we broke all kinds of precedents and barriers in setting up FTCA for health centers.
Thank you.
There were those who said we could never get it done, but it was everybody. It was you and others in Ham's district that made a huge difference in his willingness to do that because we needed bipartisan support. And none other than Orrin Hatch from Utah.
Yep.
That's how it went. So that's the personnel side of things. Let's talk about growth at Open Door from when you first arrived. How many sites did you have? What was the rough number of staff? And how many patients was Open Door serving when you took over as CEO?
We had 9,000 patients, and we had 2.5 sites, really. There was a part-time site. So today we have 57,000 patients, and I don't even know how many sites we have, because we have school-based sites, we have mobile dental vans, we have 6 health center sites right now. So we've
Those
grown
are the
a lot.
fixed sites.
Fixed sites, yeah. And again, thanks to you, I feel so fortunate. It was difficult in the early years, and our Governor Pataki wasn't at all generous, and of course, no, not at all. And of course, the hospitals are sort of the big guys in healthcare in New York, so nobody cared about us. They just didn't. But then, through the Clinton years, things got better, and I'm happy to report that the Clintons actually live in the next town. And I do see them every now and then, and I always thank them for Child Health Plus because that was very important legislation in New York, and really sort of changed the game for us because we have largely an immigrant population, and so having the kids qualifying for those benefits, although in this day and age it's quite the opposite.
Yeah, it's scary.
It's very, 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 very scary. So anyway, thanks to you, eventually the wind was at our back. And then, of course, when President Obama was elected, there was no greater period. And so that's why it's so difficult right now. We knew it was going to catch up with us, and it has.
Yeah, but you still, the good news is that through the Affordable Care Act, and New York always had a pretty progressive Medicaid eligibility system. But even then, the ACA added to eligibility, and I don't think the state has walked back.
The state
Have they?
hasn't walked back, but our patients are scared to death. And so Open Door had one of the highest rates of uninsurance in the state and in the country. We were 55%
Wow.
uninsured. And so during Obama, it went as low as 43%. And as of really the fourth quarter of last year, we've seen it start to edge up because people are really afraid. There have been ICE raids, and it's just a different time.
They're desperately afraid that if they do take advantage of the programs for which they legally qualify,
Yes.
they could put their future in jeopardy in
Yes.
terms of their ability to remain here.
And we're busy. It's not like we're not busy. Patients are coming in. So, we look at our activity every single day. So it's not like people aren't coming in. They're just not enrolling in Medicaid or Child Health Plus or WIC, for example. And they're just coming in and paying cash, which they're absolutely entitled to do. So now the big challenge for me is, okay, so now what? How are we going to evolve in the next couple of years to be able to weather this storm?
Yeah. 7,000 to 9,000 patients to 57,000.
Yeah.
That is an incredible record.
And growing,
It
and
really,
growing. We never have problems with the HRSA numbers. It's like if we build it, they come. And I think, we do a really good job. We have really nice facilities because we have a foundation. And so access to capital is not difficult for us, fortunately. We have a really great and capable staff, and we have middle-class people who like to use us as well, although our focus is really on people who truly need us and need access to very affordable care.
Yeah. But you've added services over the years as well.
We have. So, dental, we have a big dental program. We have a dental residency now in New York State.
Wow.
When you get out of dental school, you have to do a 1-year residency. So that's been fantastic because it's allowed us to expand our scope of services. So we have expanded our dental program significantly. We have optometry, we have podiatry, and then we just do so much work in the realm of enabling services, and that's really what I'm most proud of. Not that I don't love dental, and not that I don't love WIC and nutrition, but it's the enabling services that I'm most passionate about. And again, thanks to you and to Sarah. I remember Sarah talking about presumptive eligibility way back when, and that's when I sort of got smart and savvy about it and realizing that we needed a staff outside of our clinical staff. So, obviously we have clinicians, doctors, nurse practitioners, and we have support staff, but then we have this whole array of folks who do enabling services, and that's so important in our communities. And I think that's why we're so trusted as a provider, because we just have this whole army of other people that our patients can go to when they don't understand something, or we will go to them if need be.
So this is housing, education,
It's
nutrition.
really it's really patient navigation. We're not yet into housing, and unfortunately, so many of our patients don't qualify for any housing benefits.
But you can be their advocates.
We are their advocates, exactly. Yep, exactly. So patient navigation, transportation, we're in the schools, you name it, we're involved, however we need to be.
Yeah.
And we fundraise to support a lot of those positions as well.
That's fantastic.
Yeah.
That's great. It's probably an unfair question to ask you because you have accomplished so much. But from your personal perspective, what do you consider to be your greatest achievements?
Well, I have to say, I love working at the health center. So I feel so lucky that I just landed there by accident and it all fell into place. And there's not a day that goes by. I mean, truthfully, I have never had a bad day at the Open Door. I hate to say that, but it's completely
that's wonderful.
true. I do remember driving a grant application. It was before we could submit them electronically, and I do remember driving through a major snowstorm to get the stupid thing to the FedEx office. That was a bad day because I thought I was going to die because it was snowing. But anyway, the grant went in and we were funded, and so ultimately it turned out to be
It's all history.
a good day. But, I just feel like, being at the health center has just been the best thing that's ever happened to me, because the work is so incredibly rewarding. And also, I live and work in the same community, and for some people that might be a drag, like, you're in the supermarket and people are coming up to you.
All of the folks.
But it's also very wonderful. It's also very wonderful, and just to have the fruits of your labor. We live it every day, and so we work so closely with the school superintendent and the principals in our schools where we have health centers, and it's just, so exciting to see what we've done in those schools. Of course, the school-based health centers came after my kids got out, so they didn't get the benefit of it, but I knew that it would have been a great thing for them if they were there. It takes time because schools are crowded and what have you, but it's all been pretty fantastic.
Staff training and connecting, you talked about with the dental program and others. Good recruitment tools as well. No?
Excellent. We have a family medicine residency program as well. It's ours. It's not a teaching health center. We have to do it with the hospital, which is sometimes rather interesting. Residency training is difficult because it's like, do you put the residents first or do you put the patients first? I always put the patients first. I'm always thinking about the patients, so sometimes there's tension and conflict, but I think, we're better as a result. But yes, we've hired many, many physicians out of that program. I think we need a nurse practitioner residency program because we recognize that physicians are going to be tougher and tougher to recruit, and I think nurse practitioners and physician's assistant actually provide the kind of care that we deliver, and I think that makes good sense for us in the future, so we're thinking about that.
Sure, good for you. And I am sure. Talk to me about mental health and addiction care and stuff like that.
The money is dropping from the sky. Not
Grab
a
it
bad
while
thing.
you can
Not a bad
before
thing.
it hits the ground.
That's right. Those patients are among us, and so we've always provided some type of service, but to receive the funds and to actually stand up a program, it's completely integrated. Our integrated behavioral health program works really, really well. I always think about our HIV patients, and of course we've been doing HIV for many years, but patients really like receiving care in our setting because there's no stigma, because it's integrated. They don't have to go through a separate door. They don't have a sign over their head that says, I have HIV. And so they really like sort of the way we deliver those services. It's confidential, it's discreet. And mental health is kind of the same way, and substance use is kind of the same way. So it's completely integrated into our medical and behavioral health delivery systems.
So for the people you serve, that's a great benefit.
Yep.
Yeah.
Yep. And those people are among us. They are among us. So we should be doing it.
Yeah. So the future. How do you see the future for Open Door? How do you see the future for health centers generally?
Well,
From your
I'm the
perspective.
eternal optimist, although it's been a little tough out there these days, that's for sure. But, I think when you do good work, you've got a leg up. And so I feel like the Open Door, in spite of, the challenges, the headwinds that we're facing as a result of, this immigration policy, that's the bulk of our patients. So it's really been difficult. But as I said, people are coming in. They're just not taking advantage of the Medicaid benefits. So it's the economics that are so challenging for us right now. But that's okay because, we've got money in the bank, and I'm convinced we'll weather the storm. I just hope the storm doesn't go on too long.
No, that's for sure.
Yep. And we're also thinking a lot about the social determinants of health, and we really want to do more so that we can be even more comprehensive than we are right now. We recognize that so much of healthcare, takes place outside of the exam room or the dental laboratory. So we want to be able to deliver more comprehensive services to our patients, and we're thinking a lot about that, working with lots of wonderful community partners. Yeah. And I think the health center, thanks to you and all the folks at NAC, you guys have just built an incredible machine for us. And I'm just so happy that, the wind was at our back and we could take advantage of it. We wouldn't be able to do what we're doing without you. And so, we are so lucky that all those grants have been there. Nita Lowy has helped. She loves us, by the way.
Oh, yeah.
We're very happy she's head of
She has been
appropriations.
an absolute godsend.
Yep.
for
Yep.
health
She's the one that
centers.
said, would you please do school-based health centers? And I said, if you ask, we will do it.
Absolutely.
So I feel like the future is indeed bright. Probably a few more bumps in the road, but
We'll get past those.
we've been there, done that, and we'll
Yep.
just keep on going. And I'm so thrilled about the next generation that's coming up. I think about succession planning all the time because I was there myself, and Marge was lucky that I loved Open Door as much as she did. And so I look forward to sort of the next generation. And we have so many talented people on staff, many of whom were patients. And I just love that.
Really? Wow.
Yeah, patients, and have lived, the story. And so it's just so neat that they work for us and love what they do and can, sort of share the good that community health centers have created. It's a great thing.
It is. It is indeed. Thank you.
Thank you, Dan.
Thank you, Lindsay. It's
My pleasure.
You're a true icon and a leader in this health center movement. We're still a movement.
Thank you.
And it's been a thrill working with you over the years
Thank you.
as well. So
Appreciate it.
keep it going. Pay it forward.
Absolutely.
All right.